Have you ever felt totally fine while doing something simple, like folding laundry, going for a short walk, or even laughing with a friend? But then hours later, or even the next day, your whole body feels like it's been hit by a truck? It's confusing. It feels random, but it's actually a very real and well-documented part of fibromyalgia. It's called delayed pain response, or DPR, and understanding it can make a huge difference in how you manage your condition. In this video, we'll explore why this delayed pain happens in fibromyalgia, what's really going on inside your body, and practical ways to manage it day to day. What is delayed pain response? Delayed pain response means that pain doesn't show up right away after an activity or trigger. Instead, it sneaks in later, sometimes hours later, sometimes not until the next day. For people with fibromyalgia, this is extremely common. You might feel totally fine while you're being active, maybe even proud of what you accomplished, but then you wake up the next morning sore, stiff, and in more pain than before, and you're left wondering, what did I even do yesterday to deserve this? The delay isn't just frustrating, it can make it hard to connect cause and effect. That unpredictability is a huge part of what makes fibromyalgia so challenging to live with day to day. Why does this happen? To understand delayed pain, we need to look at what's happening inside the body in fibromyalgia. Fibromyalgia is classified as a nociplastic pain condition. That means the pain doesn't come from tissue damage or visible inflammation, unlike arthritis or an injury. Instead, the problem is with how the nervous system processes pain signals. People with fibromyalgia often experience something called central sensitization, a state where the brain and spinal cord become extra sensitive, even to normal sensations. So, a light pressure, gentle movement, or mild exertion might not hurt at the time, but the nervous system holds onto that input and starts to amplify it later. There's also a phenomenon called the wind-up effect, where pain builds up if stimulation is repeated or prolonged. Even when the activity is over, the brain can keep generating pain because your nervous system keeps holding onto and amplifying those signals. Research suggests that in fibromyalgia, the brain may have increased levels of certain chemicals involved in pain transmission, such as substance P and glutamate. These make it easier for the nervous system to send pain signals and harder to turn them off, so the system stays revved up even after the trigger is gone. There's evidence, too, that the autonomic nervous system, which controls things like stress response, heart rate, and recovery, often doesn't return to baseline as it should. That means your body can remain in a kind of on mode for too long, and delayed pain is the aftershock. What the research says. The science backs up what people with fibromyalgia have described for years. One study found that 84% of people with fibromyalgia reported pain 24 hours after a simple pressure test, and about half were still sore 5 days later. Other research shows that people with fibromyalgia experience more pain buildup with repeated activity, and brain imaging studies reveal notable differences in how pain is processed compared to people without the condition. So, if you've ever been told it's all in your head, know this: delayed pain is very real, and modern science supports that. How it impacts daily life. One of the most difficult things about DPR is how it affects day-to-day living. Because the pain is delayed, it's hard to predict. You might feel okay while doing something, cleaning, shopping, spending time with friends, but later you're hit with pain or exhaustion. That makes it tough to connect the dots between your actions and your symptoms. This unpredictability can lead to the boom and bust cycle. You do more on a, quote, good day, only to crash afterward. Over time, this, combined with fear of making symptoms worse, can lead to avoidance, isolation, and constant second-guessing. Planning becomes exhausting. Rest doesn't always help as expected. Sometimes you're left wondering if anything you do is, quote, safe. How to manage DPR. While it's not always possible to completely prevent delayed pain, there are ways to make it more manageable. Pacing. Build in breaks before you need them. Rest before the pain comes, not after. Tracking patterns. Journals or symptom trackers can help you identify delayed reactions over time. Gentle movement. Activities like Tai Chi, gentle stretching, or water-based exercise are often better tolerated since they're low impact and calming to the nervous system. Nervous system regulation. Simple techniques, deep breathing, meditation, guided relaxation can help bring your body into a calmer, less reactive state. Medications. For some, medications like SNRIs, muscle relaxants, or certain anticonvulsants may help by reducing pain sensitivity and regulating your nervous system. As always, talk to your doctor. It's important to keep in mind that you're not lazy and you're not imagining things. You're managing a complex condition that deeply affects your nervous system, and that takes strength and strategy. Delayed pain response can feel mysterious and unfair, but it's not random and it's not your fault. There are real biological reasons why your pain happens, and understanding them can help you manage your condition more effectively. And remember what we mentioned earlier in this video? Fibromyalgia isn't just chronic pain. It's now recognized as the classic example of what's called a nociplastic pain condition. If you want a simple, clear explanation of what that really means, check out our other video, Fibromyalgia Breakthrough, the simple science behind the pain, linked on the screen above and in the description below. How does delayed pain show up for you? Have you found anything that helps you manage it better? Leave us a comment below to share your story. And if this video helped you feel seen or understood, consider subscribing and sharing it with someone who needs this too.